Hello and welcome to your exercise buddy. My name is Dick Scavongelli and I hope you'll join me for the next 25 minutes for an exercise program that's done in a seated position that's designed to increase your strength and endurance as well as improve your muscle tone and flexibility. In addition, the workout is designed to increase your bone density. To begin with, let's find a good, firm, comfortable chair that we can work with. Scoot forward in that chair and sit up tall for appropriate posture. The proper posture positioning is to align the shoulders directly under the ears and the hips directly under the shoulders. In addition, our ankles should be positioned directly under our knees. We should sit up tall and maintain tight musculature in the abdominals as well as the lower back. Now that we're in the appropriate position, we can begin the exercises. If, however, this position has any discomfort for you or is a little too fatiguing, it's perfectly okay for you to slide back in that chair and use the backrest as support. As you improve with your strength and endurance, begin sliding forward for longer durations of time throughout the exercise routine. So, maintain the appropriate position for you, sit up tall, and to begin with, we're going to straighten out one of our legs and bring the leg back down. So we extend forward, straighten at the knee joint, and then back down slowly. As we perform this exercise, try and sit up tall and try not to lean back in your chair as you do it so that we can emphasize the midsection as well as our frontal thighs. That's it. Bring it down slowly and then extend forward. If you have enough strength, do not permit your foot to touch the floor as you do this exercise. If, however, it proves too difficult, allow your foot to touch the floor and rest. Let's do one more repetition. Up and hold and down, and now let's switch to the other side. Sit up tall, straighten your knee, and then back down slowly. An added benefit for this leg exercise, called a leg extension, would be to turn your toes up toward your knee as you perform the exercise. If you're able to do this, you should feel some stretching in the back of your calf and maybe even up into the back of your thigh, so we can work on strength and flexibility at the same time. Focus your concentration on your frontal thigh. Try and contract the muscles of your frontal thigh as you perform the exercise. Your abdominal muscles as well as your hip flexors are working hard to maintain your upper thigh in this position as you straighten the leg. Up and hold and down. Last one. Straighten that leg out, tighten up those muscles, in slowly, and then back down. Now, we'll follow each strengthening exercise with a flexibility exercise. So at this point, I'd like you to straighten out your leg, turn your toes up toward your knee, relax your thighs, sit up tall, and now bend forward at the waist until you feel a little bit of tension in the back of your thigh. The more you pull your toes up toward your knee on this exercise, the more emphasis you'll feel and the more stretching you'll feel on the back of your leg. Now let's switch to the opposite leg. Same technique. Knee is extended, toes are turned up toward the knee, leg is relaxed. Try not to hold your breath as you perform these exercises. Try and breathe through your mouth. Holding your breath will elevate your blood pressure, and we want to avoid that. Bend forward until you feel some emphasis in the back of your thigh. Toes way up toward your knee. Breathing through your mouth. You're looking straight ahead, and your back is straight. And now back up and relax. Good. Let's find that good posture position back in the middle. And now we're going to work on our outer thighs as well as our hips. So we're going to bring our knees up to our chest, then push your leg out to the side, and then pull from the inner thigh as you bring it back in, and then down. And then up, pushing out from the outer thigh and hips, pulling in from the inner thigh, and back down. Same principles apply. If this exercise proves to be a little difficult, there are several modifications you can make. Number one, you could allow your foot to touch the floor and rest in between repetitions. And another modification you could make is to not raise your foot up so high as you perform the exercise. We're doing these exercises slowly to eliminate momentum and to isolate the muscles. Pull it back in. We're going to perform one more. Remember, try not to lean back as you do this. Try and stay tight in the midsection and the lower back, and bring it in, and then down slowly. Now let's switch to your opposite leg. Sitting up tall, tight in the midsection, pull that knee up toward your chest, push out from the outer thighs and hips, in from the inner thighs and back down. Abdominals and hip flexors as we come up, outer thigh and hips as we push out, inner thigh as we push in, resist from the frontal thigh as we come back down. Way up and out slowly and in slowly and back down. We're breathing through our mouths, so we want to exhale as we exert force, and we want to inhale as we resist. Take it up and out and in and down. Last one. Last rep. Stay with it. Up, push out, pull in, down slowly, and relax. Let's follow this with a flexibility exercise. If you've had hip replacement surgery, you may want to check with your doctor before you perform this exercise. We're going to cross our ankle over our opposite knee. So I'm going to take my right ankle, cross it over my knee in this manner and sit up tall. And because I don't feel enough stretching in my buttocks and outer thigh, I'm actually going to push down on my knee a little bit and push up on my foot. Sit up tall, and you should feel a good stretch in your outer thigh and buttocks region. And now we're going to bring it back down slowly and switch to the other side. Opposite ankle over opposite knee, pushing down on the knee, up on the foot, sitting up tall, breathing through our mouth. Maintain this position, and back down and relax. Okay, next exercise is to emphasize and isolate our inner thighs. And we are going to do this by simply crossing our legs. And again, if you have had hip replacement surgery, you may want to check with a doctor before performing this exercise. We're going to cross one leg over the other and then back down. This takes a lot of emphasis on our inner thigh and our hip flexor muscles, as well as our frontal thighs, to bring that leg up, cross over, and then back down. At the same time, try and maintain that good posture as we perform the exercise, and also breathe through your mouth. Good way to remember breathing technique is to count the repetitions. That forces you to expel air on the way up and inhale on the way back down. So we're doing it slowly and down slowly, and let's do one more repetition on this side. Up, hold, and down, and opposite leg. Bring it up and over and down. Stay with it. I feel the burn. I'm starting to sweat. I hope you are. Stay tight. Breathe through your mouth. Good job. No momentum. Contract those inner thighs. Let's do one more. Bring it way up and hold and back down and relax. Okay, find that postural position. Knees bent, we're going to bring our heels up as high as we can, tighten up our calves, and back down. Heels up and down, and now let's bring our toes up and down. Now heels up and down, toes way up towards the knee, hold, and down. As we bring our heels up, we contract the calves, and as we bring our toes up, we contract the muscles in the front of our lower leg. Up and down, toes way up, hold, and down. Now let's bring those heels up and down, toes up. Last one. Heels up, down, toes way up and down, and relax. Okay, these next several exercises that we'll be performing will be done in a standing position. So what I'd like you to do is stand up and move behind your chair. I'm going to place my chair to the side so that you've got a better view, but you can use your chair for support. First of all, I'd like you to simply lift one leg a little bit and stand on one foot. The less assistance you can use by holding the backrest of this chair, the better. In this position, there are many intrinsic muscles to the foot and also ligaments and tendons around the ankle that are strengthened. And it's also good for your balance. If you do have the ability to let go, you can feel how difficult it is just to maintain that position. And all these muscles around the ankle and foot are firing, which is going to help strengthen that area as well as improve your balance. If you need to, hold on with two hands and then progress to hold on to one hand, and then keep your hands close to the chair in case you have to support yourself. And now let's switch to the other foot. Raise one leg up a little bit and try and maintain this position. The leg is straight, extended at the knee. If you need support to hold on a little bit, that's perfectly okay. Another thing that you can do if this is too difficult, even if you have to have your toe resting on the floor as a progression, that's perfectly okay as well. And then you could reach the point where maybe you don't need your toe anymore. There's also an isometric contraction going on in the front of your thigh as well as the back of your thigh and buttocks as well. This is an outstanding exercise. Okay. Now, let's use our chair for support again. We're going to switch the emphasis from our ankle to our buttocks. What I'd like you to do is keep your legs straight, look straight ahead, shoulders remain squared, and just simply bring your leg back and then forward. Now we'll focus our concentration on our buttocks as we do this exercise. Try to not permit your pelvis to rotate. You want that pelvis pointing straight ahead. You want your shoulders pointing straight ahead. Your toes should be turned up toward your knee. And you bring your leg back, you tighten at the buttocks, and then you come forward slowly. Another common mistake on this exercise is to lock out the knee of the leg of the foot that's on the floor. You want to maintain a slight bend in that knee to take the stress off the knee joint. Let's do one more of these. Bring it back, hold and resist, and now let's switch to the opposite leg. Remember, that knee stays straight, toes are turned up toward the knee. You're focusing your concentration on the buttocks as you tighten up that area and then back in slowly. You try and keep and prevent your pelvis and shoulders from rotating. And you should be looking straight ahead, breathing through your mouth. Very good. Let's do one more. Bring it back and hold and relax. Okay, this next exercise we'll perform is going to work our outer thighs and hips. We'll stay in the standing position, and we simply push our leg away from us. Just bring your leg out to the side. Again, the knee stays straight, shoulders and hips stay squared. This is another very good exercise for your balance. Let's try, when you get that leg out all the way, to hold it there for approximately 1 second and then slowly bring it back in. Rate of movement is very important when you perform these exercises. It should be done slow and controlled without jerky motions. The rate of movement should pretty much be the same as you go through each phase of the movement. Let's do one more. Up and out and back down slowly. And switch to the other side. Away and in. Good. We're also trying not to list to one side or the other. Stay with it. We're going to do a few more. Make sure you've got that breathing technique proper. Last one. Let's push it out and hold and down slowly and relax. Last one that we'll do standing is a semi-squat exercise. Our feet should be shoulder width apart. Our toes should be turned slightly out. And we're just simply going to squat down a little bit to about 45 degrees or so and then back up. Squat back down and then up slowly. Try not to lock out your knees as you come up to the top. Try not to come down too far. Try and concentrate on the front of your thighs, the back of your thighs, and your buttocks. It's called a compound exercise because it works so many muscle groups in one. The other important factor on this exercise is not to let your knees go too far forward. If you can, try and keep your knees in line with your ankles. And we're going to do one more. Down slowly and pause. Bring it back up and relax. Okay, let's get back in our chairs and find that good postural position. As we now progress to our upper bodies. The first muscle group that we'll begin with on the upper body is the chest. I'd like you to bring your arms out to your side with a 90-degree angle at your elbow, between your forearm and your upper arm. Now we're going to bring our elbows forward and try and touch our elbows together and then come back out. Bring those elbows in, touch and squeeze and back out. On the way back, try and get a good stretch. So let's stretch those chest muscles and those shoulder muscles as we come back. Looking good. Bring it way back. Make sure the upper arm stays parallel to the floor. Let's sit up tall, maintain that good posture as we perform this. Think about those chest muscles. You're trying to forcibly contract those chest muscles as though there were resistance that you were trying to push forward. And squeeze and back. Here comes the last one. Bring those elbows forward, touch, and back. And now let's bring our arms down to our side. Let's stretch our chest muscles, and the way we're going to do this is by placing our hands behind our back and interlocking our fingers. So I'll turn to the side here a little bit. The fingers are interlaced, the elbows are straight, and we're trying to lift our hands up in this position. This stretches not only our chest but our shoulders as well. Remember to breathe through your mouth as you do this. Look straight ahead. If arthritis is a problem with those fingers, you can try doing it without interlacing your fingers. And hold that a few more seconds, and let's come forward. The next exercise that we'll perform is for our back muscles. What I'd like you to do is bring your hands together out front with a slight bend in your elbow, and simply bring your hands back. maintaining that bend in your elbow as you do so. And now slowly forward. Now let's bring those hands back. The hand is pretty much in a neutral position, so the palm is not up towards the ceiling, nor is it down towards the floor. We're trying to pinch our shoulder blades together as we perform this. Forward. Sit. Sit up tall. Couple more. Let's bring it back slowly. Tighten. Pinch those shoulder blades and forward. And last one. Bring it back. Squeeze it tight. Hold it there. And in and down and relax. Okay, stretching exercise. For our back, let's bring one arm up overhead. If you have had rotator cuff problems, if this is a little difficult for you, check with your physician before performing any overhead exercises. Grab your opposite wrist and lean to the side. Feel a good stretching motion going all through your back and shoulders. Hold the position and up. And now we're going to switch to the opposite side. Grab a hold of that wrist and lean and hold. Stretch it out good. And up. And bring those arms back down to your side. Okay. Arms down at your side, arms are straight. And what I'd like you to do is simply sit up tall and bring those arms extended back. And then forward. That's it. Keep them straight, extend them back and hold, and then forward. Here we're working the muscles in the back of our upper arm. We're also working the muscles in the back of our shoulder. We're going to bring it back slowly and hold, and in slowly. Try and get them way back. Try and keep that good posture as you perform the exercise. Two more. Back and hold. And in, last one, back and hold and in slowly. Okay, now let's perform some exercises for our upper arms. What we're going to do is have our palms facing away from us, and we're going to simply bend at the elbow joint and down slowly. Now we can always increase the resistance of these exercises if we were to find some objects that we can comfortably hold in our hands to add weight to the exercise. By keeping our palm facing away, we get more of a contraction out of the muscles in our upper arm. Let's do two more, up and down, and last one. Bring it up and hold and down and relax. Okay, let's progress to our wrist and our hands. What I'd like you to do is place your wrist right on your knees and extend your wrist up and then back down. You can keep your hands or your fingers straight, or you can bend your fingers as well. I like keeping my fingers straight. Works the muscles of your finger extensors as well as your wrist extensors in this position. Up and hold and down. At the same time, try and keep your elbows down on your thighs. Let's do two more. Up and down. Last one, bring it way up and down and hold. Okay, let's bring our fingers together and push our fingers together. Let's lift those little fingers as far apart as we can and down. Now let's lift the ring fingers as far apart as we can and down. Now the middle fingers, get them way out and down. Index finger and down. And last, the thumbs. Push them way out and down. Okay, palms of your hands together in the praying position. Elbows up. Hold this position as we stretch out the forearm and hand muscles. Now let's shake them out and relax. We'll conclude this session with a deep breath. Let's stay tight in the midsection, good posture, and we're going to raise our arms out to our side and up overhead. Are you ready? Deep breath, arms out to your side. Way up overhead, touch those hands together, blow it out, and slowly come back down. And relax. Good job. You've completed another 25-minute session. I hope you enjoyed today's exercise program, and we hope to see you the next time on Your Exercise Buddy.